Today we have Dr. Mona Tareen with us. She is a triple board certified physician in internal medicine, palliative care, and geriatrics. She trained at the University of Chicago Hospital in internal medicine, followed by a fellowship at Rush University Medical Center for Geriatric Medicine and Palliative Care Fellowship at Midwest Hospice. She was a professor and director of palliative care at Rush University Medical Center and presently works as a palliative hospitalist and geriatrician at the American Hospital in Dubai, with a master's degree from University of Maryland on Cannabis Medicine. Thank you so much for being here with us today, Dr. Mona.
Thank you so much. It's my pleasure.
So, Dr. Mona, jumping straight into it and into your area of specialty, could you tell us what is geriatrics and who should be seeing a geriatrician?
So geriatric medicine is actually a subspecialty that was created for people who are 65 and above. And basically what it involves is having experience in complex care. So patients who may have cognitive impairment, hypertension, diabetes, and so on. There are some patients who actually like to go to a geriatrician even if they're not 65 years of age, because we're able to manage complexity and complex care.
Thank you. And what are the most common geriatric symptoms or disorders that you see as a geriatrician?
So some that we see are, one would be falls and frailty. We do sometimes try to send folks out into the house, so when we're looking especially at home health services, to see carpets that are loose, make sure that they're not at risk of injuring themselves. The other thing is we do memory testing. So it comes as a part of the geriatric evaluation. And there are different ones that we can use, but we look for cognitive impairment. And one of the things is the more educated you are, the less likely, the easier sort of studies or mini mental status exam that we do tend to be revealing of cognitive impairment. We also look at things like urinary incontinence as adults get older. We also understand that there are certain cancer syndromes that are more common as you age. So we look at the care of the whole person, including, health maintenance and vaccination status.
And how is geriatric care different than primary care?
I like to think we spend a lot more time, but it's not just the time that we spent with the patient. It's the detailed history and information that we get. A lot of the patients that are coming in may not recall their medications. There are things such as polypharmacy, where patients above the age of 65, they're on average about 5 medications. So they may not recall all their medications at the same time. The common problems that they tend to have, I think like Dr. Donatella, one of your guests that came on, actually diabetes is one of them. And then we're looking at other problems such as osteoporosis.
And you mentioned diabetes. In general, what would you say are the top 3 chronic conditions that geriatric patients have?
So one is diabetes would be one of them, but probably that's in the top 5. You're looking at falls, urinary incontinence, and memory loss.
And as a geriatrician, what can you recommend to a geriatric audience in terms of being proactive with their healthcare?
Just that everything is important. Please do your health screenings. Don't ignore yourself. Just because you're feeling fine doesn't mean that you are. The things that we tend to do is screening for hearing, ophthalmologists, make sure that their pressures are okay. Their dental exams are a big part of it. And of course, their insurance is, if there are listeners who have health insurance, they should take care of it. And then you're looking at vaccination status. So we have to make sure they're getting their pneumonia vaccine, their flu shots unless there's a contraindication, their shingles vaccination, screening for osteoporosis, and screening for memory and falls. So that comes kind of in the package when we see the patient. And we tend to spend on average 40 minutes on the first initial evaluation. Now, I love internal medicine physicians, don't get me wrong. I go to one myself, but they do tend to spend about 10 minutes. And then they don't go over other things like who's your power of attorney for healthcare, who's going to help you with medical decision making, who's going to help you with your finances. And then we have to understand we now live in an electronic world. So a lot of people are online, and what does online safety mean? And, people who are not trying to call you and, take the money out of your account. So financial diversion, we try to teach them everything in regards to that.
And that's a great point you mentioned about vaccination for geriatric patients, because generally when you talk about vaccination, you're thinking pediatrics. So that's a great point to bring to the audience's attention. And why would you say that geriatric patients should consider home care services, and what could the potential benefits be?
So one of the things is, especially if they're kind of homebound, they're in a wheelchair, it's difficult for them to get out. The good thing about home health, one, they may have telemedicine services, in which case you can also get your physician on board. Two, they do a home assessment. So they're going to look at the carpets, they're going to look at the stairs, they'll do an evaluation, make sure you're not what we call a fall risk. They'll also take a look at your medications, because often we have patients coming to the office, but they don't bring their medications. So then you go to the house and you see they've got 20 on the table. And it might be anywhere from a multivitamin to valerian. So there's a lot of drug interactions with older adults. So that is the difference that you have. And then the last thing would be, looking at what they're actually eating in a day. I've had patients who they stopped cooking and they would buy frozen food, and they went into congestive heart failure and their legs became swollen. So I think the home environment is probably good for them to get into that way.
So there is definitely a big role that home care can play for geriatric
Absolutely.
patients. Thank you so much for being with us today here at Dr. Mona.
You're welcome. Thank you for having me, and thank you, Health Bank.
This podcast is brought to you by the Health Bank Global.